Aging brings about many physical changes. Of the physical changes that often take place, joint stiffness is very common. Joints are important for different reasons. Joints enable proper bone function, allow movement, and support the structure of the musculoskeletal system by connecting bones and ligaments, while the body sustains healthy joint maintenance by continually rebuilding and regenerating cartilage. A person's lifestyle and increasing age can cause wear and tear on joints. Without proper care, diet, and exercise, joint health and consequently bone health are both greatly compromised. Our body is an amazing machine, functioning at its best when its composition is in a healthy balance of muscle, fat, organ systems, and bone. Through many years of poor dietary choices, sedentary lifestyles, a lack of targeted exercise, and our advancing years, we lose muscle. By rebuilding lost muscle mass, we support our body's healthy aging, improve our metabolism, and maintain the competence of our joints. While many tend to look at health clubs and exercise programs as a luxury available to few, physical exercise is a necessity for all. The right combination of diet, sleep, and supplementation is just as necessary to support those joints and muscle retention. There are many options to support overall joint health and comfort. Antioxidants like grapeseed extract or French maritime pine bark support relief from temporary inflammation associated with the normal aging process or physical activity. Pycnogenol is one of the most clinically researched ingredients in the US and Europe to support overall health, including joint health. Other well-known ingredients are glucosamine and hyaluronic acid. Glucosamine is an amino monosaccharide that is naturally concentrated in joint cartilage and bones to form amino polysaccharides. Glucosamine supports healthy joint function and promotes the normal production of synovial fluid, which lubricates joints. This is especially important if you are physically active or looking in later decades of life to support healthy joint range of motion and comfort. Hyaluronic acid plays an important role in tissue hydration, lubrication, and cellular function, and helps maintain joint flexibility. Although it is produced naturally by the body, the level of hyaluronic acid diminishes with age, contributing to joint discomfort. Whether you are looking to support your physical vitality as you age, or it is necessary to support your exercise program with a preventative support approach, speak to your healthcare professional about customizing a regimen for you. Every year, statistically, more and more people are faced with weight gain due to aspects of lifestyle. The schedules we keep for our jobs, increased rates of physical inactivity, increased reliance on convenience foods, and a rise in reported stress and sleepless nights are all to blame. With more new-to-nature foods and more sugar consumption for energy, we see widely fluctuating blood glucose levels. That's why overweight, sedentary persons need to consider taking steps each day towards better health. In particular, taking steps to support an increase in glucose tolerance and lean muscle mass through proper dietary intake, including thoughtful supplementation. Glucose, or blood sugar, is the body's main source of energy. Blood sugar levels are determined by how many carbohydrates are ingested in comparison to other macronutrients like protein and fat, how rapidly the body breaks down carbohydrates into simple sugars, and lastly, the rate at which the tissues take in these sugars from the bloodstream. Simple carbohydrates are absorbed very easily from the intestine into the bloodstream, and as a result, have the most significant effect on raising blood sugar levels, and as a result, increasing our waistlines and a risk for chronic disease. Complex carbohydrates, which include fiber and starches, on the other hand, are also made up of sugars, but they exist in longer chains, so that they take longer to break down in the intestine and thus are absorbed into the bloodstream at a slower rate. The average American is only consuming 11 grams of the 25 to 35 grams recommended for daily intake. To meet this goal, it is necessary to evaluate your own dietary intake and supplement accordingly. Fiber is largely resistant to the body's digestive enzymes, meaning much of it moves through the intestines and before it is excreted from the body, helps slow the absorption of sugars into the bloodstream. This slow carbohydrate helps maintain healthy blood sugar levels. Fiber benefits also include the ability to help maintain healthy cholesterol levels, intestinal regularity, and healthy intestinal microflora, food for good bacteria. Fiber, like vitamin D and omega-3 fatty acids, are strongly recommended by health professionals for cardiovascular and blood sugar health. Fiber should be one of the most important components of your diet, not the most overlooked. Maintaining optimal fiber and nutrient intake is critical to your health and can have a great impact on how your body functions as well as how it ages. A simple rule is to choose your foods based on color. Foods containing simple carbohydrates are often neutral in color and include processed items such as cookies, candies, chips, and processed grains like pasta and bread. Fruits and vegetables, on the other hand, contain natural forms of simple carbohydrates. Vegetables should be consumed preferentially due to their macronutrient profile. If dietary choices are a challenge for you, or if you are concerned about a personal or family history of diabetes or heart disease, you should talk to your health professional about customizing a dietary regimen for you. From the mouth to the small intestine, the digestive process, both mechanical and chemical, has one goal: change food into an absorbable form. Your goal as the patient is to ensure the quality of food choices as well as control the quantity of that fuel. The digestive system has the crucial role of breaking down all foodstuffs consumed while having the burden of differentiating that which is good from the bad. In short, the digestive system must provide the body with the nutrients and energy that it needs to operate efficiently. The increased popularity of fast and processed foods has serious repercussions for the digestive system. Processed and fast food is often stripped of essential nutrients and natural enzymes. As a result, your body is challenged even more than ever to break down foods for absorption. Unfortunately, enzymes naturally occurring in foods are sensitive to heat and are often inactivated when the food is cooked. The absence of these vital enzymes may result in a lack of necessary building blocks to synthesize the materials the body needs to achieve optimal health. There are 3 basic enzymes that help us digest our food: protease, which digests proteins; amylase, which digests starch; and lipase, which digests fats. Each of these enzymes, in addition to specialty enzymes, play a significant part in your overall health by helping to release specific and necessary nutrients into your body. Environmental, dietary, and lifestyle factors all have a direct impact on GI health and the ability for the body to maintain this balance. Failure affects intestinal permeability, immunity, and the functional barrier between absorption and exclusion. Without proper digestive barriers, our bodies can't properly balance energy levels, moods, weight, healthy skin and joints, respiratory function, and even mental acuity. More directly, when your intestine fails to limit or exclude food components that should be eliminated, we may see a rise in GI discomfort. A large number of events can lead this altered gut permeability. Stress, medications, substance abuse, dietary choices, sleep habits, even gender. The larger picture here is even when you consume a healthy diet, other factors can still disrupt this delicate balance. Digestive enzymes, often taken in addition to a healthy diet, supplement the body to support numerous beneficial functions like working with probiotics to synthesize vitamins or the release of a variety of metabolites, balancing immunity in the gut, and maximize efficient breakdown of food, yielding access to a complete spectrum of nutrients. If you have more questions about your need for digestive enzyme supplementation, you should speak to your health professional about customizing a regimen for you.